Welcome to the Healthcare Fraud Hunter podcast. I'm Dr. Steve Goldberg, known as Dr. G. This podcast is sponsored by Olivia Analytics, a company that I serve as Chief Medical Officer. Olivia Analytics technology turns healthcare claims data into easy-to-understand, actionable insights that payment integrity teams and health plans and state governments use to run their own queries and rapidly expand financial recoveries. Today is our first Healthcare Fraud Hunter podcast. On today's episode, I'll tell you about my background and why I'm so passionate about hunting healthcare fraud. We'll give you a view of the size of healthcare fraud in the United States. It's massive. Then we'll talk about some of the guests that will be joining us on upcoming episodes. Sounds good? Let's get started. A bit about me. My colleagues have encouraged me to share my practical experience through a podcast. I'm a real doctor, a practicing physician, and a physician executive that has had responsibility to drive best experience, best healthcare, and best value for large companies and tens of thousands of lives. I've seen the challenges and the pain and the negative clinical impacts on health outcomes that expensive care has on people and families. Now, they say you have about 4,000 weeks of life. I'm grateful to be healthy, but the truth is, if I'm lucky, I've already spent about 3/4 of my allotment. As I roll through my third and fourth quarters, I'm on a mission to contribute to U.S. healthcare that is more equitable, effective, and proportionally less expensive. Healthcare takes up a huge amount of spending in the U.S. and way more proportionally than other industrialized countries. By 2031, it will account for roughly 1 out of every $5 spent. For example, we spend 5 times more on healthcare than we do on groceries. Just absorb that for a second. Here's some other facts. According to a paper in Health Affairs from July of 2023, for the full year of 2022, our national healthcare spend was $4.4 trillion. By 2031, it's projected to be $7.2 trillion. That's a growth of 5% per year. According to the National Healthcare Fraud Association, financial losses due to healthcare fraud are in the hundreds of billions of dollars per year. They estimate it's 3 to 10% of all healthcare dollars are lost to fraud. I don't know about you, but this should be concerning. One of my favorite quotes is from Edward Deming. Every system is perfectly designed to get the results it does. In this podcast, we want to understand what enables crooks to take 3 to 10% of healthcare dollars per year, and what can we do about it? We'll talk with innovative minds in analytics, artificial intelligence, government, law enforcement, health plans, clinicians, and other brave individuals who are on the front lines of this campaign every day. Our guest lists and topics can be found on oliviaanalytics.com. I hope you'll join me. I couldn't be more excited about the topics and the guests we'll bring to you. Thank you for listening to the Healthcare Fraud Hunter podcast. I'm Dr. G. If you enjoyed today's episode, please hit that subscriber or follow-up button on YouTube or wherever you listen to your podcasts.